Ask a health professional and they will tell you a transplant is the best treatment for patients with kidney failure. The problem is there is a shortage of donor kidneys, and despite public appeals, the rate of donations has not gone up in 10 years. Well, researchers at the University of Calgary think they have a solution, but it's controversial. Michael Serapio has the details this morning. Michael, what are they suggesting?
Well, essentially, Heather, they say it is time we consider paying for donor kidneys. Now, this is not a new idea, but the idea is now being attached to a dollar analysis they say makes some sense here. Now, essentially, the authors of the study argue by offering a financial incentive, say $10,000, the transplant system would actually see an increase in donations that would take people off a transplant list, and that would save those transplant patients as well as the medical system dollar figures in the form of saved money as they get away from expensive dialysis treatment. Now, as you say, the study does originate from the University of Calgary. It was published yesterday in the Journal of the American Society of Nephrology. And this is the dollar figure that they're actually talking about. They say if you offer about $10,000, a conservative estimate would say that there'd be about 5% increase in the number of kidney donations you would get. Well, that donation and taking those people off dialysis would save about $340 per patient. Now, that's a conservative number. Now, consider if it jumps 10 or 20%, which they say is still possible with $10,000. They say the savings would then jump to roughly about $1,600 to $4,000 per patient. They base this on 2010 dollar figures, and also an earlier study that found that 54% of people who in the past said they would never donate a kidney changed their minds if they are offered $10,000. Important thing to bear in mind when you consider that about 30% of people waiting for kidney transplants die before ever getting a suitable kidney.
And yet, if you open the Pandora's box, Michael, of money for organs, all sorts of ethical dilemmas come to the fore. What has been the reaction to this suggestion?
You're absolutely right, because this has been floated before. The dollar analysis is what's new about it. But with this study was also an editorial that was published in the same journal from Dr. Peter Rees from the University of Pennsylvania. Now, he points out to 4 potential pitfalls here. One, the idea that people would undergo risky surgery that they would not undergo in giving a kidney for the dollar figure. The idea that the impetus would probably be put on poor people from lower socioeconomic backgrounds who need that $10,000. Also, the idea that would kill the current altruism in the system. And also the big issue that many people consider it an indignity to the body to sell any part of the body or an organ. Bear in mind that organ selling is illegal in all countries except Iran right now.